Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome, welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls right here, right now, 866-870-5752. Right here in the studio, you can talk directly to Dr. Darrow. And you get a free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's Dr. Darrow's latest, and the foreword is by Suzanne Summers.
So, phone number. I need some callers. Come on. Otherwise, I talk too much. Anita gets bored.
Oh, no, I don't get bored. I do not get bored. I'm just grateful you're not telling jokes.
Well, thank you for reminding me.
Yeah, I knew I shouldn't have said that.
You know what? That always gets us callers. I'm going to give you a chance for Anita not to be tortured with dumb jokes that she has
please
to
call
answer.
me. See, this is what's it's kind of puzzling because I think people get nervous about talking on the radio or whatever.
I think so, but there's no reason to, because we just have fun.
We just have fun and educate people.
You know what's so funny, Nita? As soon as we mention the jokes and torturing you, we have 2 callers coming on.
I'm so grateful to them. I am going to send them chocolates. I will.
So the number to the Nita, you need your own chocolate.
I do.
I know that you're a chocolate hoard.
I'm a chocoholic, card carrying, actually.
You know what I do? My office has several pounds of chocolate that are stashed in a corner, so that whenever my staff needs a little hit, they come in and they take a bar.
That I have to
Everybody
come to your
loves
office.
chocolate.
I haven't been there lately. What a
No,
great
you
idea.
haven't. Please come over and we'll grab some dinner.
Right.
Yeah,
okay.
you're very welcome.
That's right. The new restaurant. Okay. Well, let's go to John in Long Beach.
Well, let's hang on 1 second. I'm going to
okay.
give out. John, you hang there 1 second. Your wife has shoulder issues. We're going to talk about that. But I'm going to give out the number again because I'd love to light up the boards here for the next half hour. It's the number to call in is 866-870-5752, 866-870-5752. And for calling in, I'm going to mail you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got lots of studies on how stem cells and platelets do work and how musculoskeletal surgery can really cause some problems. And I have to say this all the time. I love surgeons. They do the hardest work in medicine. But unfortunately, these surgeries for orthopedics are starting to die out, unfortunately for the surgeons, because people are getting smarter and realizing that the surgeries can cause lots of problems. If you have a broken bone, go get a surgery quick. If you have meniscal tear, rotator cuff tear, bulging discs, things of that nature, arthritis, please don't think about surgery first. Think about repairing it and regenerating. It's so easy. You walk into the office, you get injected, and you walk out. You don't even need a driver. John, you're up. So your wife has shoulder issues. And how old is your wife, by the way, John?
I've listened to you continually on 870 and enjoy it very much. My wife plays beach volleyball 4 or 5 days a week. She's about 65 years of age.
Yep.
Physically, she's in great shape. Her shoulder's giving her lots of difficulty. She's had 1 cortisone shot. Now they want to do an MRI and this and that and maybe do another cortisone shot. And I think that I'm trying to find out if what you do, the stem cell, would help her.
Okay, that's great. And she's a very appropriate candidate for this as long as she has range of motion at all in her arm and it's not like really bone on bone. Where
she's swinging and she's hitting.
If she's swinging, she's a real good candidate. And the cortisone shot she had failed, as they do. If you're active, the cortisone is a really strong anti-inflammatory. But the bad news is that it also destroys the cartilage. So real bad idea to get that done. And at least from my point of view, I know traditional medicine gives cortisone all day long, over and over and over. I had one woman come in who was a tennis player, and she had lateral epicondylitis. The elbow was bothering her. So she had something like 16 cortisone shots over the years, and she could not lift her wrist. The cortisone dissolved away her extensor tendon. So I had to work long time to rebuild that tendon for her by regenerating it. We got her back on the tennis court again, but it took a long time. And that was, I'm gonna call it dumb by doctors to do that. They know better. They know what this does. So for your wife to consider getting another cortisone shot, in my humble opinion, I'm not the god of medicine, and traditional medicine doctors would probably try to burn me at the stake if they could, because I go against the grain of traditional medicine, because I don't like it, and I don't think it helps people in most cases. If you're dying and you're in the intensive care unit, yeah, that's a great place to go to the hospital and get some medicine and stuff like that. But many
Sure.
things that we have are over-treated and medicated and operated on that should not be, in my humble opinion. So I'm sorry that's the way I feel. I hope I'm not making any doctors angry with me. But the tides of medicine are changing, and we are morphing into a new stage of treatment, which is more along the lines of being natural. The public is waking up. The internet, Google is waking people up, and their friends who have had failed surgeries are waking them up that they don't want to get another surgery. I have people come in every single day
Sure.
who go, my doctor told me I need a surgery or I need cortisone. I don't want to do it. Can you help me? And most of the time I can. Sometimes I can't. And regenerative medicine using platelets and stem cells doesn't heal everybody for several reasons. You could pick the wrong candidate, number one, somebody that you can't really help. You can pick somebody who's too active. I just had a guy come in yesterday who's a landscaper and he rides dirt bikes, okay? And his knees are terrible. And I said, I can help you if you're willing to change what you're doing. What's the Einstein statement, Nita? Do the same thing over and over. The definition of crazy, do the same thing over and over and expect different results.
Right.
So his wife and him came in, and they wanted, God to come down and do a healing, and that's not me. All I can do is generate new tissue, but then you got to leave it alone and let it heal. And that was not something that this guy wanted to do. And I don't blame him. I don't blame him at all. No one wants to give up things that they love. It's like
Sure.
I get people in who are obese every day. And I go, I got to, let's say they have knee pain. I don't know if you know this, John, but people that have obesity have more arthritis in their knees because there's more weight on the knees. And every pound on the tummy in excess
Well, that makes sense.
is an extra 5 pounds. And if you're going up and down stairs, that's, logarithmically more pressure on the knees. So it wears them down. And then I tell them, I give people a little sheet with a keto diet. I had a woman come in yesterday, and I gave her the sheet, and she looked at the stuff she's not supposed to eat, and she goes, but that's all the stuff I like to eat. You know what I mean? So,
Sure.
nobody's going to listen to me 100%, and patients cheat on me. They tell me they're doing things that I ask them to do, and then they don't follow orders, and then they don't get better. Okay? So this is not
Let me
some...
ask you this.
Yeah.
How long typically, she would be hard-pressed to give up volleyball. I don't know that she's willing to do that. That's a love. That's one of the things she loves. But
it depends on what she's doing. I'm not saying she would give up. I don't tell people to give up their sports. The case of the gentleman and his wife who came in yesterday is an extreme case, though.
right,
Dirt biking is not good for the knees. I don't care who you are.
no,
And he's
I
not
could do
old,
that.
but he's a middle-aged gentleman who's been doing this stuff his whole life, and he does landscaping. So he's on his knees all the time. There's only so much the body can take. The body is a mechanical device. Thank goodness it knows how to repair itself if you don't kill it. If you're not beating the heck out of it. So that guy can still do his work. He's got to hire some people to do the heavy lifting for him, though. Dirt biking, he could still do it. He's just got to be a little more careful and maybe not go in real bumpy terrain. So, we have to modify our lives as we get older. We don't want to. There's a lot of sports I used to do I don't do, but I still do sports.
Sure.
I'm 74. I'm not going to go out and play tennis all day long and then expect to go play tennis all day long the next day, or golfing, whatever it is that I like to do. I actually gave up tennis years ago because I just beat the heck out of myself because I did not enjoy playing tennis easy. The only way I enjoyed tennis is the way that I call being a gladiator. I'm serious. Yeah, I'm serious. The only tennis I enjoyed was being a gladiator. So when I'd back off from the power moves and the fast runs to catch the ball, I didn't like it. It just wasn't tennis to me, so I stopped playing. Luckily with golf, I'm still in the... golf you can do, you can be a perfectionist at golf and hit the ball easy and put it down the middle and have a great short game and a great putting game and beat everybody. Tennis isn't like that. Maybe it is, and I don't know how to do it. But tennis is pretty ballistic.
Well, let me ask you this. My wife needs to call your office. What's the typical time to get in?
I'll tell you the way you can get in real quick. Call there now at 800-300-9300 and tell them to get her in right away, that I said so, because she's on the radio. Otherwise, she may wait a while. And then if that fails, just email me through the website at www.lastemcells.com. Just send me an email. Every page has a spot to email me, and I'll get her in as soon as she wants to.
I'll give her a call. So, I'll call right now, and maybe I'll let her know that I'm going to set an appointment for her, and then I'll call the office, and maybe Tuesdays and Thursdays are good days for her.
I work every day. I work every day, so there's no issue with that. And I don't think she's going to have to give up her sport. It's not about you have to stop doing what makes you happy. Some cases, though, she doesn't. I'm going to just be honest with you. From what I'm hearing, she's not that bad. Okay.
Well, she's in a lot. It's in a lot of pain when she's sleeping.
No, I get that, but I don't get that she's that terrible.
She takes an Advil or Aleve or something like that.
I don't get that she's that terrible. Not like the guy that came in who could only bend his knees, maximum 90 degrees flexion. That's bad.
All right. Well, I hope that it works. One last thing I would say is that my granddaughter had. She was a setter at the Pac-12.
Yeah.
Very good, but she had a leg issue. We went to, the premier,
orthopedic surgeon.
Orthopedic surgeon, and that used to be in Inglewood.
Yep.
And they really never were, and she basically at some point she couldn't play without pain.
Yep.
And they gave her a medical retirement. And one of the things I regret is that I didn't get her to your office. I got her to the Curl and Job. I got her wherever, but I should have gotten her because it was. And what they basically said that if she didn't retire, she could end up with a real serious injury that might not heal. But anyway.
Yeah. Well, listen, I'm gonna say it like this, John. All day long, I hear patients coming and saying, "I have to get surgery," and they don't get it. They don't get the surgery. Right. They get healed by what I do. Not everybody gets healed. This is not a panacea, because a lot of people don't listen to me or don't do enough treatment. They think this is some kind of miracle. It's not a miracle. It's just a different type of treatment. It's not a miracle because it's called stem cells or PRP or some magical term that's out there now. It's just simple. You get a treatment. It stimulates new tissue to regrow and regenerates the joints, tendons, and ligaments, but you have to do enough of it. And the big problem people have is they go, how many treatments will it take? And I have to always answer and say, I don't know. Sometimes it takes one, and sometimes it takes many. And I know that because I've had all the injuries on my body.
Sure.
I'm the guinea pig.
Right.
I'm still experimenting on my body to find better ways of doing this. I just injected my knees 2 nights ago. And I did something that I've never seen a doctor do before. And it worked. On one knee, 100%. The other one, it worked about 50% overnight.
Well, that's good to hear. Well, I'm gonna give her a call, and I'm gonna set an appointment for hopefully this Tuesday or Thursday.
All right, man. God bless you, and God bless your wife.
Thank you so much, and God
Thank
bless
you.
you.
There's good hope she'll be playing volleyball again without pain. No promises. I don't
All
promise
right.
anybody anything.
Well, that's what we want.
Okay, that's what we want, and that's what we go for.
Thank you so much, John. Appreciate your call. Do you want to go to Perry or give the phone number?
Well, I'm going to go to Perry because he wants to know if treatments work after an arm and leg stroke. But first, I'm going to give out the phone number, Perry, so don't go away. The number to the office is, Perry, hang with us. The number to the studio to talk to me right now live is 866-870-5752. That's 866-870-5752. I'll give you a free copy of my book. I'll mail it to you for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's got the foreword by Suzanne Summers. She's had this work done on her several times for her injuries and for her son Bruce and for her grandkids. I've been working with them for years and years and years and years. So they've had good results. I've had good results on my body. I've had good results on patients, thousands and thousands and thousands of patients over the years. So Perry, you had a stroke. How long ago was that?
Oh, 4 years.
Okay. And
It was a
are you able-
hemorrhagic stroke resulting in left side paralysis with
Okay.
arm and leg spasticity.
Okay.
I recovered a lot, but I just wonder if platelet or stem cell would help with the spasticity as I'm doing physical therapy.
Okay. So probably not for that. Okay, because that means that there's been a nerve issue. And what it could help with, though, is typically...
Well,
Can you hang with me, Perry, so I can finish, and then we'll get back to you. Thank you.
Properly connected, yeah.
Okay. So with a stroke, and I did a lot of stroke work in my training at UCLA, at the VA in West LA and Sepulveda, and at Rancho Los Amigos Hospital. So I'm very familiar with stroke patients and spinal cord injury patients. And a lot of them will have joint pain. Let's say you had a stroke or a spinal cord injury and you're overusing a joint, you're in a wheelchair or something like that. Then regenerative medicine helps those joints and helps rebuild the cartilage there, or tendonitis that comes in from overuse. But it doesn't, so far, at least from what I know of, help spasticity, okay? There's other things for that, which you already know about because you're probably getting injections for that, but not regenerative medicine of stem cells and platelets, at least not in my knowledge. There may be some doctors who do that, but I'm not familiar with it. So what you ought to do is go on the internet and go to Google and put in stroke and regenerative medicine, those two words, and see what comes up, okay? So I don't have any more information for you on that other than a question. Do you have any joint pain after your stroke?
I have not. Initially, I did, but some acupuncture I had initially really took care of that.
Wonderful. I love that. Yeah. And my point in medicine to everybody is be conservative. Surgery is not conservative. I have seen people die on the table or die later, get infected and all that. I know there's a lot of surgeries that do need to be done, but the people I see generally do not need a surgery, even though they've been told they do need a surgery. And surgery, unfortunately, if I thought surgery was the right thing to do, I would be doing it. I was training in orthopedic surgery, okay? I loved it. And then I had a bad shoulder surgery on me. It wasn't the doctor's fault. It just came out bad. And then I jumped ship, okay? I became what's called a physiatrist, physical medicine rehabilitation. I lost faith in surgery. And since then, all these years I've been practicing medicine, I get way too many surgical failures that walk in the office. So I'm not making this up. I'm not saying surgery is bad. It's just the surgeon should be choosing wiser who he operates on. There's just too many surgeries being done that don't need to be done. And I argue with my friends who are orthopedic surgeons all the time, and they laugh at me and go, "What you do doesn't work." And I go, "How do you know?" They go, "Well, I tried it once on somebody." It's not like that. when you do regenerative medicine using platelets or stem cells, sometimes you have to repeat it several times. It's not necessarily a one-shot deal. It can be, but very often it's got to be repeated until you grow enough tissue to heal the area. And I'm not the guy who knows how many times it's going to take. It's one of the most difficult things I have to discuss with new patients. It's like, when will I heal? I don't know. How many times? I don't know. It's just the way it is. But guess what? They tell me, well, I'll just get a surgery and then it's done. And then they come back after a failed surgery and go, it wasn't one and done. Now I'm worse. Now what do we do? I can still treat people after a failed surgery in most cases, unless it's just metal that's put in, joint replacement. But even some of those I can help. I had someone come in, I think it was a couple weeks ago, that had knee replacement with a lot of pain on the lateral side, the outside of the knee. And I looked with my ultrasound inside and I saw fluid in the lateral collateral ligament. So we took care of that. We aspirated the fluid and put in some platelets in there and helped heal it up. But most of the time when there's a joint replacement, it's too late. There's nothing I can do. So I'd be cautious about getting a surgery. If you're going to get a surgery, before you do it, go see somebody who does regenerative medicine first. Get their point of view. Why not? It's one more office visit. Don't go to another orthopedic surgeon. You probably get the same diagnosis and the same thing. So anyway, Perry, I'm glad you're doing pretty good, and good luck to you with reducing your spasticity. We're going to go to Charles. Charles, Dr. Marc Darrow, how are you today? Your knees are bothering you? How long has that been going on?
Yes, I have. I went to a arthritis doctor I was referred to, and I asked her about stem cells, and she told me I had to go to Europe to get those. Okay. And then she has a method she talked about. I don't know if she's going to, where they drain the kneecaps, yep, and they injected gelatin. Yes. And it cost me $800. It would have cost me $800 right, each knee. So I left immediately, and I just didn't feel like I wanted to inject anything into my knees.
Okay, so let me tell you my experience personally. I talked about this at the beginning of the show. I don't know which medicine it was they wanted to inject, but it sounds like it may have been Durolane, which is a synthetic hyaluronic acid, which does cost $800. That's why I think it's that one. Okay. So I tried that on my knee just as an experiment, and my knee blew up. My thigh blew up. I had a lot of fluid in my knee, and I'm still working on fixing that knee. I never should have done it. I didn't know better. I experiment on myself all the time. I started experimenting back in the late 90s on using this stuff all over my body. And I never injected myself before with that hyaluronic acid, because I know a lot of doctors do that. And if you ask them, they say, yeah, it works great, blah, blah, blah. But when I talk to patients, and I just had another patient come in who had the same result I did. They came in, their knee was full of fluid, and their thigh was swollen, and I measured it. It was also their left thigh, just like mine, and theirs was 3 inches bigger than their right thigh, and they're right-handed, which means the right thigh should have been bigger, but the left one was bigger. So we fixed him up. We put some stem cells in there. We aspirated out the fluid, and he came back 2 weeks later. He is almost 100% better. So I don't use that stuff. I don't like it, and I don't think it's the right thing to do. All it is a lubricant, and if you got fluid in your knee, that is hyaluronic acid. It's already lubricated. God bless everybody. Thank you so much. Thank you for callers. Thank you, Nita, Alex, Suzette. You want to reach me at the office, it's 800-300-9300. Go to the website. You can watch the procedures, www.lastemcells.com. Thank you.
Remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.